Okay, well, welcome everyone to our current LERA session on, it's a best paper session on HR practices, wage penalties, and unpredictable schedules. I'm the chair of this session. My name is Dionne Pohler. I'm currently at the University of Saskatchewan-Edwards School of Business and the University of Toronto Centre for Industrial Relations and Human Resources. We have, I think, two exciting presentations today. I don't think our third presenter is going to be able to join us today. So we have lots of time to have a good conversation about these two papers. And I'm just going to introduce all of the presenters right now, and then I won't have to do it in between both of their sessions. I'm going to start with Danielle Lamb. Danielle is an associate professor in the Department of Human Resource Management and Organizational Behavior in the Ted Rogers School of Management at Toronto Metropolitan University, formerly Ryerson University. Danielle's research broadly focuses on employment and earnings disparities in Canada, and her current line of research is concerned with non-standard work. And Talia Emanuel, who's going to be co-presenting a paper with Danielle today, is a Master of Science in Management student in the Ted Rogers School of Management, also at Toronto Metropolitan University. Talia's research focuses on diversity in the workplace and academia, with a particular focus on invisible disabilities, and she's actually supervised by Dr. Danielle Lamb. And then our third presenter today, who'll be presenting the second paper in this session, is Peter Fugiel. Apologies, Peter, if I said your last name incorrectly. You can correct us if I said it incorrectly. Peter is a sociologist of work and organizations with interests in job quality, work-life conflict, and labor standards. His current research examines the extent of unpredictable work schedules and the development of scheduling regulation. He completed his PhD at the University of Chicago in 2021 and is currently a postdoc at the University of Illinois at Urbana-Champaign. So welcome to you all, and welcome to everyone who has joined us in this session. It's nice to see everybody on I guess it's not as early of a Sunday morning, depending on where you are, but for some of you, it might be quite early, so welcome. So we're going to start with Danielle and Talia's presentation on new Canadians working amidst a new normal, recent immigrant wage penalties in Canada during the COVID-19 pandemic. So I'll turn it over to Danielle.
Great, thank you, Dionne. I think Talia will be starting off the presentation, and then I'll be jumping in.
Right, so our presentation is on the impacts of COVID-19 on immigrant wage penalties in Canada. Let's just go to the next slide, please. So just for overview, first I'll be going through the background and motivation for our study and our research questions. I'll have Danielle discuss the data, methods, and results. So feel free to ask questions throughout or at the end. Let's go to the next slide, please. So in Canada, immigration is driven by skilled immigrants. Immigrants fall into three broad classes: economic immigrants, family class immigrants, and humanitarian immigrants. In 2019, 58% of all new immigrants were economic immigrants. However, in spite of this focus on skilled immigrants, newcomers have historically faced barriers in labor market integration, including experiencing higher rates of job education mismatch and wage penalties. The Canadian government has recently introduced numerous policies aimed at improving immigrants' labor market integration. However, few recent empirical studies have focused on the immigrant native wage gap. The COVID-19 pandemic also highlighted and exacerbated many existing economic inequalities, both in Canada and other parts of the world. For example, in the US, male immigrants experienced higher rates of job loss and lower probability of finding employment due to COVID-19. Similarly, early research in Canada showed that immigrant men were more likely to worry that COVID-19 would impact their ability to meet financial obligations, and immigrants in general were more worried about losing their jobs. At the same time, the Canadian government continually signaled the important role immigrants and newcomers will play during Canada's economic recovery from COVID-19. In fact, the Canadian government increased immigration targets for permanent residents by 50,000 between 2020 and 2021. Next slide, please. So given the increasing rates of immigration and existing challenges in labor market integration of new immigrants, we want to explore the labor market impacts of COVID-19. particularly for recent immigrants. We had 3 primary research questions. First, did COVID-19 impact the labor force status of recent immigrants, as measured in the likelihood to be unemployed or to leave the labor force? Second, how did COVID-19 impact the average earnings of workers, and is this relationship different for immigrants as opposed to native-born workers? And third, how did COVID-19 impact earnings across the earnings distribution? So did the pandemic have the same impact on low-earning workers as it did on high-earning workers? And is this relationship different for recent immigrants? So now I'm going to turn it back to Danielle to discuss our findings.
Great, thanks, Talia. So the data that we used for this study is from the public use files of the labor force survey, a popular Canadian data set that is where we get our official unemployment rate. So it's a very robust data set here in Canada. We're using the public use version, and we're taking data from April and October only because the data set uses a rotating 6-month sampling panel. So to avoid having repeated measures of the same respondents, we're taking those 2 months that are 6 months apart. That's important because it's an important limitation in capturing the pandemic period. We consider 2018 and 2019 to be pre-pandemic, and then 2020, 2021 to capture the COVID pandemic period. We start out by using a multinomial logistic regression to look at the relative probabilities of being in one of 3 labor force states, employed, unemployed, or not in the labor force. And then we can move on to our main research question, which is the impact of COVID, not inferring causality. Be careful of that, but just to look at the relationship between COVID and earnings with a particular lens to recent immigrants at the mean and across the distribution. We attempted, emphasis on attempt, to correct for some selection bias into paid employment during the pandemic using 2 instruments and a Heckman selection correction. The first instrument is the average daily rate of COVID-19 cases per month for each province. And the second instrument is the maximum work from home capacity. And that was developed by Dingle and Nyman that based on ONET data in the US and adapted by Deng, Morissette, and Messakar to Canadian data. So that Deng, Morissette, and Messakar provided the framework adapting this scoring mechanism for maximum work from home to Canadian data. And those are the scores that we use in this paper by province, and then we tried again by industry. And standard control variables for earnings regressions are included. So I'll jump right into the results, present those fairly quickly. I've highlighted what I think are the main takeaway messages. The first one, looking at the logistic regression, you can see in the green highlighting that the COVID period is related to an increase in the probability of unemployment and not being in the labor force relative to being employed for all groups. That's not surprising. Also, regardless of COVID-19, recent immigrants, in particular males, were more likely to be unemployed versus being employed, and recent immigrant females were more likely to be unemployed or not in the labor force relative to employed. So that's irrespective of the pandemic. The piece that this paper was interested in is what's highlighted in blue, the interaction between being an immigrant, recent or long-term, and COVID period. And you can see that none of those coefficients are significant. So we conclude that at least for the 2 months that we've considered in the study, that COVID was not differentially related to the probability of labor force status for immigrants. Moving on to our key question about earnings. Again, in the green, we see that COVID is positively associated with an earnings advantage for all groups. And this is another result that we have to be sort of cautious in interpreting. It could be reflective of actual wage increases. We've heard about hero pay and various ad hoc policies that employers implemented during the pandemic. That could be in there. But we also know that there's a lot of fluctuations in employment rates and people leaving the labor market, joining, and so on throughout the pandemic. So it could be driven by the phenomenon of low wage earners in particular exiting the labor force during the pandemic. And that was noted by Crust and all in the US. And we think, similar things are happening here in Canada. So some caution in interpreting that result. Regardless of the pandemic, so I'm looking at the yellow, recent immigrants faced a steep earnings discount of about 20%, both males and females. So regardless of COVID, recent immigrants were not faring well in terms of wages in the labor market. Again, the interaction, how did the COVID pandemic, did it differentially have an effect on immigrants? Well, we actually find that for recent immigrant males during the pandemic, they experienced a small earnings boost of about 4%. So that's the positive interaction of a coefficient of 0.44 for recent immigrant males during COVID. That's at the mean. So then we wanted to see, what does this look like across the earnings distribution? So again, we see a similar pattern of COVID-related earnings increases, but for recent immigrant males, we find that the COVID wage bump is largest at the bottom. So that's sort of consistent with this concern of low wage workers exiting the labor force, as well as some of those ad hoc policies I mentioned that were targeting especially frontline workers during the pandemic. So we find at the 10th and 25th percentile, recent immigrant males, these are males only in this model, experienced a slight additional COVID earnings boost, but that disappears as we move up the earnings distribution. For females, similar pattern among recent immigrant females at the bottom of the earnings distribution below the median. But interestingly, I don't have really an explanation for why this might be the case in particular, at least not a good explanation. As you move up the earnings distribution, so for recent immigrant females at the 75th and 90th percentile, there's actually an additional COVID earnings penalty. So that may be, again, some selection effects happening where maybe high earning women were not likely to leave, they were likely to stay, and therefore relative recent immigrant women did not fare as well. I'm not sure, that's some conjecture. But interestingly, similar pattern of COVID earnings wage boosts at the bottom, for females, COVID earnings wage penalties at the top. And this is, of course, in addition to the earnings discounts that recent immigrant, both males and females, are experiencing regardless of the pandemic. So just to quickly summarize all of that, we find that COVID did not differentially impact the labor force status of recent immigrants, at least not in the months that we considered. The pandemic was associated with an earnings boost for all workers. Recent immigrant males experienced a small additional earnings advantage at the mean. Across the distribution, the earnings advantages were largest for those at the bottom. For females, we see that same pattern, but interestingly, towards the top, recent immigrant females experienced an additional earnings penalty during the COVID pandemic. I didn't report the selection corrected results for the OLS estimates because I don't think the instruments were all that great. But I can tell you that the results were very similar to what we found uncorrected. And I don't think that that's because that's necessarily true, that selection bias isn't a problem, but rather I think our instruments are just not capturing the complex labor demand and supply mechanisms going on throughout the pandemic. But they are detailed in the paper if anyone is interested in looking at those Heckman corrected results. So to kind of round this out and sum up, some limitations I did allude to, but they are important in exercising some caution because our time period is not reflective of the whole pandemic. We did try to do a little bit of a sensitivity analysis and test out different month pairings, and it did make a difference in terms of labor force status, which months we chose. So that's more sensitive to the particular months. Our earnings relationships were not sensitive to the month pairings. They were pretty consistent, but that's an important limitation because the pandemic looked very differently and across the country throughout the 2 years that we experienced it. But to just kind of make the point of the paper, the fact that we didn't find that recent immigrants were dramatically worse off in terms of their relative employment position or earnings as a result of the pandemic was of relatively little consolation because of the steep earnings discounts experienced by recent immigrants in the first place. So while COVID didn't make them markedly worse off in terms of earnings, it may have in other dimensions, but that doesn't give us a lot to boast about because the earnings are so much lagged behind the Canadian-born counterparts. So this further underscores the importance of support programs aimed at successful labor market integration for new immigrants. And that brings us to the conclusion. So we're happy to take any comments, questions, criticisms. Happy to hear from you. Thanks very much for your time.
Thank you so much, Danielle and Talia. That was excellent. Just also for everybody else to know that this paper is actually forthcoming in Canadian public policy in a special issue on COVID. And so if you're interested in reading it, you can get it there. One of the things I wanted to just start with a sort of a general comment, and then I have a bit of a question, is just that I think that this descriptive work around what's happening or what happened during COVID and possibly what's still continuing to happen is really critical to kind of help us sort out what happened and the heterogeneity, especially of the impacts, because I think there's a lot of easy sort of grand narratives being kind of sent around in a variety of different ways. And I think that this kind of work is so critical to actually show what happened. And then of course, moving beyond that into sort of understanding why we don't necessarily see the things that we might expect. And so this is actually going to lead into a question. And then I see we have two others. My question is, early in the pandemic, I had published a paper with Courtney Cable, a PhD student at the U of T, that actually showed that low-income workers, while many of them did disproportionately lose their jobs or hours, there was a substantial group of them that actually ended up working more hours during the pandemic. And I think this is consistent with your results. And I'm wondering if one interpretation of this, and what your thoughts are based on the data you've looked at, is that actually, these workers were labeled essential. And so they were more likely to have to continue to work because they couldn't get the income supports if they quit their job. And so this is one reason why we see that such a racialized impact of actually the COVID disease on low-income workers. I'm wondering if that's consistent with kind of the story that's in your data, or if you think there's any way you could actually sort that out a little bit more somehow to see sort of who was actually working on the front lines, and if that's one reason why we don't see an earnings penalty and actually a possible slight advantage.
Yeah, thanks, Dionne. I think that makes a lot of sense. We didn't look in this paper at who was most impacted by COVID, but I think actually, Morley, in your paper with Ting Ting, you did. And we did in another paper. And the fact that recent immigrants are more likely to be in these frontline jobs is definitely a consideration where they might not have experienced some of the hours losses. But then I saw something else that showed income. And I think there was, for that, I don't know the time period, but people did experience lower incomes, recent immigrants in particular. So I think hours worked is a really important piece, but highly heterogeneous depending on the occupational group that you're considering and how that group was affected. So I don't have a good comment other than I agree. And I think it needs more fine tuning in terms of a study that might look exactly into those occupational groups distinctly.
Thank you, Danielle. Okay, we'll go to Morley for his question.
Hi, Danielle. Quick question, and that is, I understand why you use the April and October months only, but did you ever consider doing sort of a robustness test to see if you included all the months, given the issues around that, or maybe dealing with those issues? But did you ever consider doing that?
We didn't stack all the months. What we tried for a sensitivity or robustness check was to try different 6 months pairings. So instead of April, October, we would do May, November, and then I think it was June and December. I'm not sure of the other ones. So we found doing that the earnings was stable. The earnings relationships were pretty stable, regardless of the month pairings we chose out of the 3 we tried. But there was differences in the various labor force states. So months did matter for labor force states, but we didn't try stacking the whole thing and just, going forward regardless of repeated measures. That we didn't try.
Thank you, Danielle. We'll go to Dionne next.
Yeah, thanks, Dionne. And Danielle and Talia, I have a question regarding the gender finding. So I'm wondering whether in your data set, do you have a measure for the family responsibility and the care responsibility? So I'm wondering whether the gender effect is driven by workers' family status or whether they have a childcare or family care responsibility at home?
Yeah, thanks. That's a really great question. Just trying to look at our models. We do control for, I believe, I might be speaking out of turn because I'm going by memory, for marital status and presence of children. Beyond that, unfortunately, the labor force survey doesn't have a more granular measure of caregiving responsibilities. But certainly, I think that's a great point that could definitely affect, especially that gendered result that we find.
Thank you.
Thank you. And there's a question in the chat from Catherine. Just saying that love to hear more about the Canadian policy response to the pandemic in terms of supports for these workers and their families as relevant to your findings. If you want, maybe we could have that conversation at the end, and so you can give some thought to it and answer that question after.
I would actually defer to your expertise, Dionne, because I think you have covered more about the policy response than we have. Unfortunately, we can't pick that up in this data, and it was so kind of, I don't know, maybe there is a way, but a way of finding who's taking these benefits and at what point in time. That's something that we couldn't capture in the LFS.
Thanks, Danielle. And actually, Catherine, we can have, because I was actually thinking about this in relation to both Danielle and Talia's presentation and Peter's presentation, which is upcoming in terms of some of the policy responses around this kind of space. So we can have that conversation a little bit more after Peter's presentation. So now I am going to turn to Peter, and Peter is going to be presenting a paper, For Whom is Unpredictability a Problem? Evidence from the American Time Use Survey 2017 to 2018. So over to you, Peter.
Thank you, Dionne. Can everyone see my slides? Excellent. So yeah, my name is Peter Fugiel, and I'm a postdoc in the School of Labor and Employment Relations at the University of Illinois. And this research is supported by the Project for Middle Class Renewal. Today, I'm going to be using data from the American Time Use Survey to get at this question of for whom is unpredictable scheduling a problem. For those of you who are not familiar, there's been increasing scrutiny of this problem, which is often associated with particular jobs, such as retail cashiers or fast food workers. And many of them have varying shifts or hours of work, which can change with little warning or recourse for workers. And that kind of unpredictability obviously creates problems for planning your life outside of work, whether that's childcare arrangements, schooling, other kinds of non-work activities, and can also have some detrimental effects, which previous research has highlighted. So in light of this, there's been growing efforts, regulatory efforts to try to remedy this problem, most notably in the form of what are called Fair Workweek laws, which have been proposed or enacted in about a dozen cities and states in the US since 2014. And these laws generally require minimum length of advance notice, often 2 weeks of the work schedule, the right for workers to decline schedule changes, and to receive compensation, particularly for last minute changes. It's often referred to as predictability pay. As I've already mentioned, prior research documents an array of detrimental effects of unpredictable schedules, increasing stress, poor sleep, disrupted routines, and economic hardship, both for workers and the people who depend on them, particularly young children. And a lot of this research distinguishes between different forms of unpredictability or instability in schedules. And one of the key concepts is to distinguish between employer-driven instability and more employee-driven flexibility in scheduling. So schedules can vary for a range of reasons, In some cases, that variation reflects beneficial accommodations for the worker. And in other cases, it reflects employer-driven changes in scheduling. So I'm going to follow this literature in relying on this distinction and primarily focusing on that unpredictability driven by employer or kind of business factors. Now, one thing I want to assess, interrogate from the prior literature is the focus on retail and food service workers, which have received a lot of the attention, both from scholars and from policymakers. And there's a perception or an assumption that these workers are both more likely to experience unpredictability, have higher rates of unpredictability, and are more vulnerable to some of the ill effects. And so, these are things that, I think there's good evidence from studies within those sectors that this is a problem and, negatively affects those workers. However, there's been less research outside of those sectors. So what I'd like to do today is to address this question of what is the prevalence of schedule unpredictability across the US labor market? And how well does the targeting of Fair Workweek policies on retail and fast food align with where we see greater rates of unpredictability in the survey data? So one way to think about this is there's two sides, two aspects of this problem of unpredictability. There's the scheduling practices within workplaces, and then there's the policy response to that. And this research is really examining the alignment or match between those sides. As I've already said, I'm using data from the American Time Use Survey, specifically the Job Flexibilities and Leave module, which was collected by the US Census Bureau in 2017 and 2018. And I've restricted my analysis to employees age 18 to 65, of which there are over 9,400 in my sample. And the two measures of interest are first, a question about the degree of input that workers have into their starting and ending times. I'm going to interpret this employer decides response as an indicator of no worker input. So again, relying on that distinction between employer versus employee control over scheduling. And then combining that with another item on the length of advance notice of the work schedule, and particularly this less than 1 week response I'm interpreting as an indicator of short notice. So then unpredictability is operationalized as the combination or overlap between a lack of worker input and short notice of schedule variation. So these percentages are the overall share of working age employees in the US who report either input with more advanced notice, short notice with some input, and then this overlapping region, 5% of employees who report lack of input and short notice. I'm going to present just a few tables breaking down those rates of short notice and unpredictability, first by sex and race ethnicity of the worker. And here we see that men are more likely than women to report unpredictable schedules, 7% compared with 3% overall. And that Black and particularly Hispanic workers report substantially higher rates of unpredictability as compared with Asian or white workers. Turning to industry and occupation, I'm showing just a few sectors, but I believe they illustrate a broader pattern, which is really central to my research questions. Here we see at the top, hospitality and retail workers have about average, or even lower rates of unpredictability compared to other sectors. And transportation, particularly construction workers, have much higher rates. As many as 1 in 5 workers in construction say that they have less than a week advance notice and no input into their schedule. In terms of occupations, managers, perhaps unsurprisingly, have low rates of unpredictability, in part because many more of them say they have some input into their schedule. More surprisingly, food service workers report somewhat lower than average rates of unpredictability, despite prevalent short notice, about 1 in 4 saying they have short notice, but only 3% saying they also have a lack of control over their schedule. Manufacturing and property service occupations, which would include janitors, groundskeepers, and security guards in large residential or office buildings, are much more likely to report unpredictable schedules at 2 to 3 times the overall average. So already we can see some degree of mismatch between the scheduling practices that are being reported on the survey and the policy targeting of Fair Workweek laws. So unpredictability is more prevalent in sectors like construction and property services that have largely been excluded from regulation or even discussions around this problem of unpredictability. So far, Chicago is the only jurisdiction to include a wider range of industries in its Fair Workweek ordinance, notably including manufacturing, warehouse, and property service workers, however, not other transportation or construction workers. And I think one way of understanding this mismatch and beginning to develop a more kind of encompassing explanation of for whom unpredictability is a problem is to recognize that ultimately this problem is socially constructed. And so it's not only a function of the scheduling practices, but also how those are framed and how social movements and other actors are mobilizing around that problem. So I would suggest, hypothesize that some practices are more salient or more objectionable than others, particularly when they are being perpetrated or carried out by large recognizable employers, and when they affect low wage or otherwise vulnerable groups of workers. And there's limit to what I can do to substantiate these claims, these hypotheses with the survey data, but I will show just one additional table, which has the same industries and occupations as before, but here I'm showing the percentage of workers who fall into what we can think of as different vulnerable groups. So single parents, those earning relatively low weekly amounts. Here I've chose $600 a week, which is equivalent to $15 an hour for full-time work. And then those who hold multiple jobs, suggesting perhaps that their main job is not providing adequate hours or income. And here we do see that hospitality and food service have higher rates of, a higher share of workers in these vulnerable groups. So particularly about 8%, more than 8% of workers in hospitality are single parents. 11% have multiple jobs. Similarly, in food service, see 7% single parents and 10% having multiple jobs. And those are also industries where earnings tend to be below this threshold of $600 a week. Retail also has a large share of workers with lower earnings. And so I think we can see that particularly for retail, it seems like the scheduling practices, the extent of unpredictability is perhaps not sufficient, or maybe not even the primary kind of factor motivating the targeting of these sectors, and that we also need to think about who are the workers with these jobs, and what sort of other features about their jobs or about their lives might make them particularly vulnerable to the ill effects of unpredictability. So there are many limitations of this research in terms of getting at this question of sort of social construction and the broader cultural, political context of scheduling problems. So I'll just talk about that in terms of opportunities for further research. I think it would be very helpful to have more case studies outside of retail and food service looking at scheduling practices. Obviously, there's been great ethnographic and organizational research in sectors like construction and logistics. There's been less that's focused specifically on scheduling. So it'd be helpful to have that as a point of comparison. More specifically, I think there's a lot of opportunity for science and technology studies looking at the technologies, the systems used for scheduling, whether that's custom-built software applications or something more conventional, manual. There's often a focus in the political discussions and even a lot of the scholarship around algorithmic scheduling and the problem of sort of software dictating workers' schedules. However, there hasn't been a lot of research to really explore how the quality of scheduling compares under algorithmic versus other systems of scheduling. I think it would be very interesting to, obviously I've focused on the US, it'd be very interesting to see whether those sectoral differences in scheduling practices are similar in other countries. And then for my own research, kind of the next steps that I'm looking toward in addressing this question is to better understand the making of these Fair Workweek laws. So who are the policymakers and stakeholders that have been involved in developing these scheduling standards? How are they thinking about the problem? What kinds of information are they drawing on? In addition to kind of research and labor market statistics, right? Other kinds of information being provided by worker centers and others who've been organizing around this issue, particularly in retail and fast food. So that's where I'm headed, but I'm also very eager to hear your suggestions and questions, and perhaps some comparative perspective from Canada as well. So thank you for listening.
Excellent. Thank you so much, Peter. Another really great presentation that I think I just love these kinds of presentations that go against what my pre-existing hypotheses would be. And so another great one that kind of at least makes us question some of the prevailing narratives. And I really liked the perspective on the social construction, right? And how maybe different actors are trying to kind of get these issues on the agenda by using kind of salient or salient kind of certain situations or circumstances where it becomes, it's really clear it's quite objectionable to kind of garner this mobilization. So that's, I think, a really interesting insight. My question actually to you is around, I guess the first question is, when were the Fair Work Week laws implemented? Were they in 2014 in the US?
So that's when the earliest campaigns began. The first to be passed was the San Francisco, what's officially known as the Formula Retail Employee Rights Ordinances, which were, I believe, passed in early 2015. The implementation took a while longer, but it's worth keeping in mind as much as this is spread, and probably the most expansive coverage being the Oregon Fair Work Week law and the Chicago ordinance, we're still talking about a relatively small segment of workers. So, you know.
And so I guess go ahead.
I'm just anticipating the concern that, you know, my data come from after some of these laws were implemented. And so perhaps we're already seeing changes in scheduling practices.
Yeah, that's, I mean, basically
I'm not able
just
to separate out those, you know, jurisdictions and look at
but
covered versus not covered.
But would that maybe be one reason though why that there's less unpredictability in the fast food? If those laws were primarily targeted, even if it covers a small group of workers and that were primarily targeted towards those sectors, is that one reason why we might actually now be seeing lower unpredictability, because the laws actually did work in those sectors? That's just because your data does come sort of a little bit after. I'm just wondering if, you know, if they actually did work, and that's like an interesting question then. And then now we see these other sectors that actually look kind of more problematic as a result. So it's just something to kind of think about. If there's any way you could try and kind of sort that out, that would, I think, be really interesting. So I'll just leave it at that, because I see we have questions from Morley and Dionne again. So Morley, go ahead.
You've focused, or you've looked at the three dimensions: the right to refuse, and then the right to know in advance there. But the third dimension of compensating wages, in terms of future research, I think you could look at whether there are compensating wages paid for ideally each of those components, and whether or perhaps both of those components. So there's a well-established literature on compensating wage differentials for job attributes, and that, including scheduling. So I think you've got the data to be able to do that. The techniques can get pretty rough and sophisticated, but that's one thing. Another would be, my guess is you wouldn't have the data on it given low unionization rates in the US, but to do a union, non-union cut on this, strong expectation being that unions would, of course, bargain more for the right to refuse in advance and the right to know in advance there. Even if you can't get the data on that, you could examine collective agreements to see how many have clauses on each of those, etc. So that's just adding to your to-do list of future research.
Yeah, no, these are excellent questions. And in fact, you know, I feel validated that you raised them, because I have another paper where, you know, I look precisely at this question of compensating differentials, or really any form of compensation, not necessarily monetary, for not only unpredictable schedules, but unstable hours. And so broadly conceptualizing that as scheduling risk, which classic economic theory would predict you receive a premium, you know, something to offset the additional risk that the worker takes on. And in that paper, I use longitudinal data from National Longitudinal Survey. The 1997 cohort has some detailed questions on scheduling arrangements. And I find that, in fact, workers with more risky schedules receive lower compensation on average than in jobs with comparable jobs with more stable schedules. And this is particularly the case for these kind of non-monetary forms of compensation. So something you hear a lot in the debates, particularly from opponents of scheduling regulation, is that workers enjoy greater flexibility in these jobs. And so they're willing to take on the risk of canceled shifts or work-life conflict because they also receive beneficial flexibility. And what I find in that sample, it's doesn't cover the whole labor force, but for workers in their 20s and 30s, they report less flexibility with unstable schedules. And again, it's a penalty rather than a premium. The union, non-union comparison, I had a similar kind of assumption, hypothesis, that union workers would experience less scheduling risk. However, overall, they're just as likely or even more likely to have instability, particularly around the hours of work. And a lot of that is driven by the sectors where union density is higher, manufacturing, kind of traditional blue collar jobs. There can be a lot of unplanned overtime and people taking on extra hours, but not necessarily having much advance notice or control over that. So I think that union, non-union comparison, it would be helpful, again, to have maybe some sector-specific comparisons to see how scheduling practices compare. Again, a lot of the research is focused on these largely non-union sectors. There are some retail unions, particularly grocery stores in the US. Many of them are unionized, but the research I've seen suggests, there's some protections workers have around, maybe seniority and access to hours, access to desirable shifts. But for this younger group of workers that I studied, it's not obvious that a union contract is a guarantee of stability or even compensation for scheduling.
Thank you, Peter. I'll turn to Dionne next.
Thank you, Peter. I think I have the similar question as Molly, and you already answered my question about the union effect. So I think for future research, I'll be interested to look at the cross-country comparison. So maybe in the countries where the worker powers are greater, we'll see less predictable schedule, and it may have less impact on workers' well-beings and the stress level. So I think that'll be an interesting future research to examine outside of the US context.
Yes, I agree. And I think the big limitation there is just what data is available and what data have comparable items on scheduling. So if anybody has specific data sources or references to suggest, kind of the main person I know who's done some of this research is Elaine McCrate, who has used some European data and I believe also Canadian data, and has again found that there's these kind of gender disparities, and there's some indication that can be a function of kind of welfare state generosity in programs, which can actually make it easier for women and particularly mothers to hold unpredictable jobs, to take on scheduling risk when they have accessible, affordable childcare, for example. So I'm not sure if that's been published yet, but she has like an ILO working paper where she provides some of that evidence.
All right, thank you so much. I think I'll follow up with you and then ask more questions after the presentation.
Thank you, Peter. Actually, just to quickly, Danielle and Talia, do you know, just on this sort of comparative angle, is there an equivalent kind of time use survey? I'm not familiar with in Canada. Is there one? Do you know?
There might be. I'm not sure about time use. I haven't looked into that. But there are some measures in the LFS that you might be able to use. Like there's a differentiation between actual hours and usual hours. And so that might be helpful. And there's a really neat survey in Canada. It's dated now, but it's the General Social Survey. One of the cycles, I think it's 30, it's 2016, but they have a lot more deeper dive into variables around work that you might want to check out.
Thank you.
I think that one does include something on whether you or your employer chooses your work hours, a similar question, if I remember correctly.
Well, and I guess also the Workplace and Employment Survey has a lot of questions about who sets the hours of work and flexible work arrangements and scheduling practices. But the problem with that survey is it's even more dated. It was ended in 2006, but that one also would have a lot, and it would have a lot of different industries in it as well.
Yeah, I think that's one that McCrate, Lambert, and Henley did an analysis of, looking at volatility in work hours, and again found that there's a compensation penalty rather than a premium, particularly for workers who are underemployed and then have more volatile hours.
Yeah, like it's a perk for higher income people and people in stable jobs to have more flexibility, but not like this unpredictability is an actual penalty for lower wage and more precarious workers. Yeah. So I just wanted to also we have a few minutes left and turn maybe to Catherine's question that I said we might turn to if we had a bit of time at the end. It's interesting, Catherine. There is if you send me an email, I can send you some papers that have been written around the Canadian policy that was introduced during COVID-19. A couple of colleagues of mine from the Center for Industrial Relations and Human Resources did kind of an evaluation of some of the COVID policies in Canada. It's also in Canadian. Was also published in Canadian Public Policy, and one of the interesting things is that I think similar to what happened in the US, we realized that unemployment insurance very early on in the pandemic, when the government kind of required businesses to close and really implemented quite stringent lockdowns in a lot of provinces, that unemployment insurance was really not well set up to provide income support for the people who were really detrimentally affected by the pandemic. A lot of people weren't eligible for it. It wasn't going to provide enough in terms of replacement of benefits. And so the government introduced really quickly kind of a more generous form of unemployment insurance called the Canadian Emergency Response Benefit. And everyone who lost their jobs was, I think there were some sort of early iterations over the eligibility criteria and that kind of thing, but everybody was given $2,000 a month. For several months, that program was in place. They also introduced at the same time a Canadian emergency wage subsidy, which was provided to employers to provide workers, to provide some sort of income support for workers that employers could use. And there's been a lot of controversy over both programs, and especially the wage subsidy, whether or not the employers that got it were the ones that needed it. I think similar kinds of debates that are happening in the United States. But one of the really interesting things I think about the income supplement or the income support program that was targeted to workers was that workers couldn't quit their jobs to get it. And so, one of the things that we found early on is that there were a lot of low income workers who were working more, and these workers were more likely to be in these essential public facing roles. And this is one reason why the actual virus hit these communities a lot more heavily. And so there were a lot of problems. A lot of workers fell through the cracks, I think, of some of our income support systems in Canada. But there's a lot more detail in some papers I can send you if you send me an email. So hopefully that's a just really brief kind of overview of some of the Canadian policies. But like I said, I can send you more detail.
Yeah, thank you.
Okay, and yes, and if you have any questions, by all means,
I had one thought, particularly around the earnings penalty that you found for female workers at the upper end of the earnings distribution. And this comes from a puzzle I found in the US data I mentioned earlier, where I was looking for compensation, differences for unstable schedules. But I found that there was this kind of penalty associated with low unemployment, which was surprising. And when I dug into it, I found that it was concentrated on non-hourly workers. So, like salaried workers, it seemed like they were increasing their hours of work in, periods when unemployment was low. Maybe there was greater demand, but their earnings weren't increasing in the same proportion. And so when you looked at the hourly pay, it showed up as a pay penalty, but really it was being driven by these cyclical changes in hours. So I'm not sure if you have a way of distinguishing between workers who are actually paid by the hour versus paid on another basis, but that might be some way of getting additional insight into those earnings differentials that you found.
Yeah, thanks, Peter. That's a really interesting consideration. I'm not sure we can get at that in the LFS because the LFS sort of crunches that number for us. But I don't know if there's a way to think about that, looking at usual hours versus actual hours. Something that's
yeah. If you could maybe try to decompose, right? Changes in hours, changes in earnings.
Great, thanks.
Yeah, I think that's interesting, especially because particularly looking at healthcare, which tends to be a lot of female workers and higher paid female workers. You saw a lot of labor shortages throughout the pandemic, so that might account for a lot of overtime for those who are working full time, like working not hourly. Thank you for that.
Danielle, there's also the paper in industrial relations that I published with Courtney on this. We actually try and use this difference between usual and actual hours worked within the LFS. And so you might want to look at, that was kind of my early question, was sort of around if there's a way that you could get at it using those usual versus actual hours. Because usual hours, what we also were finding is that early in the pandemic, people weren't changing their reporting of usual hours in the LFS because they assumed this was just like going to be a 2-week thing, right? And so they said, this is my usual hours for quite another month, at least into the pandemic, but their actual hours had changed. And so that was a way that you could also use that as a control for those individual employees as well. So that might be a way that I can send you that paper if you send me an email.
That would be great. Thanks, Dionne.
With that, I see we have 1 minute left. Hopefully everybody was able to ask their questions. Thank you for 2 excellent papers. It really truly was a LERA Best Papers session. I, again, really enjoy these kinds of papers that make us think differently about things, that we might have different kinds of hypotheses going in. So thank you all for joining as well, for those of you who came and asked questions and observed. Have a wonderful Sunday, everyone.